You're a nurse that works with ABGs. This video is for you. These are some rapid fire tips and tricks that pertain to ABGs. ABG stands for arterial blood gas. It is a sample of blood that is taken from the artery, and the most common things that we look at in ABGs are a patient's pH, their partial oxygen of their blood, the partial CO2 of their blood, and the partial bicarb. Now, there are other things that we can look for on ABGs, but when it comes to nursing, these are the most common things that you will be looking at. The two most common times that I see ABGs drawn are one, when a patient has a change in their oxygen demand. Maybe they went from room air and now they're on a non rebreather, or a change in their work of breathing. The second reason is altered mental status. This could mean that the patient is now suddenly restless, agitated, maybe now they're confused, all the way to super lethargic or obtunded. And this is because in patients that are retaining CO2, a lot of times that can mess with their mental status. A normal pH is between 7.35 and 7.45. If you draw an ABG and the pH is within range or close to normal range, there is typically not as much urgency to call the provider right away and be like, hey, oh my gosh, this patient's pH is 7.34. Now, of course, there are other things that we're looking for on the ABG. So I'm not saying that that's like a hard rule, but in general, if your patient is compensating or their pH is within normal range because they have a normal ABG, there's not as much urgency to knock on the door and be like, hey, I have this ABG. When you're looking at ABGs, when you see the CO2, think respiratory, and when you see the bicarb, think metabolic. You may have heard of the term ROME, respiratory opposite, metabolic equal. This is a term that's used to help you remember how to interpret ABGs. So, for example, if you have a patient that has a low pH, but their CO2 is high, respiratory opposite, right? Our arrows are going in the opposite direction. This is most likely a respiratory issue. And then for metabolic equal, if you see you have a high pH and a high bicarb, this is potentially a metabolic issue. ABGs can also be mixed, so it also can be both. You may also have a CO2 issue and a metabolic issue. If your pH is within normal range, but your CO2 and or bicarb are out of range, you have a compensated ABG. If your pH is out of range and your CO2 and or bicarb are also out of range, then you either have an uncompensated ABG or a partially compensated ABG. When you're looking at the PaO2, this is solely telling you if the patient needs more oxygen. So for example, if your patient's on 4 liters and their PaO2 is 55, they probably need some more oxygen, or at least some more oxygen right now until we can figure out why they need more oxygen. Okay, that is a very quick overview of ABGs. Honestly, there's so much more that we could go into, but if you want to learn more, I have an ABG crash course that I think would be super helpful for anyone that wants to feel confident interpreting ABGs and understanding why we use them.